So for me, it was pretty easy. First and foremost, it was for my family, and then obviously for friends and coworkers.
I have a young son. He's 17 months, and there's no vaccine for his age group, and we're unsure when he will have a vaccine available for his age group. So I wanted to keep him safe. That was really important to me.
Because I have underlying medical conditions, and my husband does as well, and my mom, who I take care of quite often.
Getting the COVID-19 vaccination was an easy decision for me. I wanted to not only do my part to stay protected, but also for my loved ones and to be able to start seeing family. And
the risks of COVID were far outweighed by the benefits from the vaccine. So in the end, it seemed like an obvious decision to go ahead and get the vaccine to protect myself and my loved ones.
So in order to protect myself and my family, with both of my parents being higher risk people, I made the decision to get the vaccine. I did do some research into it and realized through that the idea of the way that they're doing the vaccine was not anything new. It was just new to the flu vaccine, and it had been being used in other research areas.
Which is, I have a lot of family members with underlying health risks whom I haven't been able to see since the pandemic has started. So receiving the shot for not only myself, but for my loved ones, to be able to see and hug them again.
I just wanted to speed up the ability to get back to life that we all enjoyed before.
I just thought it was really important. This is, how we get on the other side of this, and it's also how we keep people safe. So,
and overall, just trying to get some normalcy back. I enjoy traveling, so if this is what we've got to do to start getting some normalcy back, then I was more than willing to do it.
And also the community, and just being able to safely go to sporting events or events at work, and being able to have that sense of community back.
And as a military firefighter here in Bangor, we respond to a lot of international flights, so we could be interacting with people that have COVID and not realize it, and also the domestic aircraft flights.
I'm not a frontline worker, I'm not a healthcare worker, but this was a way that I could help make sure, in addition to wearing my mask and social distancing, that I could keep those around me and keep my community safe and healthy. So it was important to me to be able to do so.
Getting my vaccination was a very easy process. I signed up through pre-registration on a health system's website. I arrived at my appointment, and the volunteers were really friendly. I think I had a shot on my arm within about 10 minutes.
Vaccination was pretty seamless. I was able to go right online and sign up for not only my first shot, but my second shot at the same time. And all of the information and directions were sent directly to my email.
But I just called the local pharmacy, and I never spoke to a live person. It was all automated. Just had to punch 1 for no, 2 for yes, enter my birth date, enter the zip code of the town that I wanted to get my shots in. And in less than 5 minutes, I had my first and second appointments both scheduled, the first one being the very next morning.
Wow. The sign-up process was fast. It's a 2-shot. They offer the Pfizer vaccine at that clinic. And right when you book your first appointment, they give you your appointment for your second shot, so you don't have to worry about going back in and trying to figure out when is 3 weeks from now. So they made it very simple.
So, unlike most people who have a reaction after their second dose, I had more of a reaction after my first dose. I would say mild to flu-like symptoms lasted 24 hours. Got a good night's sleep and woke up the next morning feeling 100% ready to go. And then
vaccination was fine. I got the Moderna, and the only thing that I really experienced from the first shot was a little bit of a sore arm, which I expected from people telling me that was something that they went through. And I had my second shot last Saturday and was expecting it to be worse from what everybody was telling me, but I had just a little bit of tenderness on the arm.
A little bit of headache after the first shot, but that was very mild and went away after less than a day. And even if I had more severe symptoms, certainly that short episode of some symptoms or response to the vaccination pales in comparison to being in the hospital or having more intensive treatment. So I felt that was a small cost to pay for the peace of mind of having the vaccination.
I did have a few mild symptoms after receiving the shot, but overall the experience was very positive and just overall pretty seamless.
The next day I felt a little bit sluggish, but other than that, I didn't feel any different than I do on any given day.
I don't consider myself to have a high pain tolerance or to enjoy, vaccinations, but it was painless, and I'm not kidding, like no pain whatsoever. So I couldn't say enough good things about it. It was a very positive experience. So.
And I waited about the required 15 minutes before I was able to leave. And I think, one of the things I noticed when I received my vaccine was it was really not only really easy, but everyone was very friendly, and there was just a lightness in the air. And I think it was as though hope and everyone doing their part was just understood.